So I'm just here today to talk to you about the McGrath breast care nurse role and how we support you through your diagnosis and through your treatment and how we can link you into local services. So firstly, we've got 223 McGrath breast care nurses across Australia now, and the foundation, the goal is to have 250 by the year 2025, which is next year, and we're well on the track for that, and that's only because of donations from people like you that make it actually possible for us to be able to do that. In South Australia, we have 19 McGrath breast care nurses, and 5 of those are in the metro hospitals, and then the 14 are in the regional areas. I'm lucky enough to have 2 of those positions, so I am the breast care nurse in Adelaide Hills and also in the Murray-Mallee region as well. We've got a new position that has been developed, which is a metastatic breast care nurse role, which is, I think, really important for us. We have 2 of those positions in South Australia, so one of those is in the RA with Kate Cox, and then the other position is with Deb Hayes, and she's actually here at the back, and I might just get her to wave her arm around so you know where she is. So if anyone has been diagnosed with metastatic breast cancer and needs more support, please reach out to Deb and we can have a talk about that, and we can link you in with that service as well, which is really important. We do have a few other McGrath nurses here with us today. Everyone's wearing their pinks, so we're easily identified, so please go and find the girls and have a chat to them later as well. As breast care nurses, we're there from the time of diagnosis and throughout the treatment. We provide information, coordinate your care, we act as your advocates, and we support you and your families. We provide care for people with both early and metastatic breast cancer across both the public and the private sectors, and our service is free. A breast cancer diagnosis can be confusing and difficult and can lead to other stresses in your life, and we understand that you don't only need help with your cancer treatment, but you need support for the way that the cancer affects the rest of your life and impacts your life. We're here to make some sense of all the information that's been given to you, and we provide continuity of care and a consistent contact for you and your families throughout your treatment, and hopefully add just a little bit of local love so that you might be able to link into some of those local services to make your journey just a little bit easier. I like to think that we add just a little bit of sunshine into your life and just help you make sense of what's going on around you. There's lots of different roles that we actually play through your journeys, and I've just put it into sort of 4 categories, and I'll talk about those as we go. And then at the end, if I've got enough time, I've got a case presentation, hopefully just to pull it all together so it all just makes sense in how we do that. I've got a video and I'm a little bit nervous about whether it will work or not. If it works, it's a video and it has nothing to do with breast cancer at all. It's something that I've been tagged in a lot. I find it quite entertaining and I think it's funny. But it's how I would see you going through your breast cancer journey without the extra care and support of a McGrath breast care nurse. You have the support of your family and your friends, and you have your amazing treatment teams, and you have the other breast care nurses in the other hospitals, which are amazing as well. So you will get there and you will get to the end, but hopefully with us by your side, it kind of makes that roller coaster ride just that little bit smoother. So we'll see if it works. It goes for a minute. Oh.
Well, I've got to do it, haven't I? Do another option? You're just keep push for you. You're going to have to go for it somehow. You're going to have to do it. Yeah. Ready? I can't stand on your back. I'll break you. Let go. Okay, I'll give it on. Good. That's it. I can't!
Sorry. Hopefully that makes some sense to some of you as well. There's lots of information available about breast... Oh, well done. Lots of information available about breast cancer that's both reliable and unreliable. As your breast care nurse, I try to guide you through the information and help you understand and reduce your worry, and it's linking you into those reliable sources. For example, the BCNA, which have got really reliable, up-to-date information. They've got some amazing podcasts by Charlotte Topman. I think I link everybody into her podcast all the time, and there's some really fabulous webinars on there as well, so you can find the things that you're looking for in that site. We act as your advocate. Your care is led by a team of experts who work together, and we work really closely with your team as well. And we just make sure that your care is focused around you and not so much around your cancer. We're there to care and support not just your families, not just you, but also your families, and making sure there's support there because you need them to support you, so we need to support them to support you, if that makes sense. Locally, I work, so in Murray Bridge and Adelaide Hills, work really closely with the multi-D team, which means that I work really closely with the physios, the OTs, the community nurses, dietitians, social work, mental health team. And I also work really closely with your treating team as I need to. So sometimes I don't need to at all, and other times we need to do a little bit more linking in. It's about, because we live so much further away from town, transport is often an issue, and also like financial problems and burdens because of that transport. So sometimes it's about linking you into services that are local, so transport schemes and medical buses that can take you down. So we can link you into those things to take some of the burden off your families. Finances become a huge burden for a lot of people depending on your treatment plans and pathways. So sometimes we link you into things like the Cancer Council with the financial aid, where we can link into some of those fundings, and sometimes linking you into social work teams so that we can tap into some other funding organisations as well. Just letting people know about superannuation. So sometimes superannuation has inbuilt income protection in that as well, and you don't know about that until somebody tells you about it. So it's just about finding those information pieces. Exercise programs are really important for people to do during their treatment for the lymphedema, through your chemo and all those sort of things. There's amazing teams in Adelaide that have got treatment plans and exercise programs, but they quite often want you to be there twice a week, which isn't realistic for people that are living further away. So it's about linking you in with local services. So here in Murray Bridge, we might have like the Inner Health or Inner Soul, where they'll do an individual plan for you. Or in Adelaide Hills, we're actually really quite spoilt with a number of exercise programs like the Pink and Still program, Next Steps program, and we can link you in with those as well. Other services that we can link you in with is obviously the local wig library, and I know that they're here today, so please go and talk to the girls over there about the wigs that we have here that are available. Look Good, Feel Better, and I just want to quickly mention that if anyone hasn't done a Look Good, Feel Better program, Kathy is here and she's desperate to run a workshop in Murray Bridge, so please let her know if you're interested, and if you haven't had a time of doing a Look Good, Feel Better program, she'd be really happy to run a session here locally as well. So we can support our patients with clinical care before, during, after surgery, chemo and radiotherapy. In some cases, travel can be a huge barrier for people travelling down and having to have their care in Adelaide. So your breast care nurse can often do those wound reviews for you and wound care and things as well, and we liaise with your treating team. That's not always as simple as that though, but sometimes we can do that for them. Sometimes you have post-op issues with seromas or cording, and seromas is where you get that pocket of fluid, which is different to the lymphedema, and often your treating team want you to go down to town and have that drained, and sometimes that's not a viable option, so we need to link you into GPs locally that can do that for you. I do the cording locally, but often we can refer you to physios that, or lymphedema specialists that specialise in that as well. I really love my laser. I think a lot of you know that. So I have a big focus on scar therapy and management, and teach you how to look after those scars as well. Lymphedema is quite a big area, and especially in a space in Murray Bridge and this area. Most breast care nurses don't do a lot of lymphedema management, but often have done courses so they can help you assess symptoms and management, and they can help with referral pathways. Years ago when I started here, there was no lymphedema therapy here, and you had to travel to Adelaide. So I had people coming from Lameroo and Pinaroo, and they wouldn't go to Adelaide because of transport issues and things. So I've done the lymphedema therapy course so that I could treat some of my patients locally. I'm really, really excited to say that I now have support and help here in Murray Bridge, and we've got a lymphedema nurse that has started with us at Adelaide Hills, the Barossa, and also Murray Bridge, and she's sneakily sitting at the back. So Rachel Strong is doing that, mainly focusing for women with the lymphedema with garments at this stage, but that will probably develop over the next couple of months. And just as a sneaky side note, she does lower legs, and which I don't do. So if you have friends, relatives, family that needs any help, she really loves them more customers. If your lymphedema is more than I can manage and I feel like you need some more support, or you feel like you need some more support, I do like to link you in with a lymphedema therapist. Because they live and breathe it all day, every day, and that's what they do, and I think that's a really important thing. Mandy Harrison, I don't know if you're actually here today. If you are, can you wave? Because we've never met. But anyway, I talk to her a lot on the phone. She's also just started doing lymphedema in Bridgewater. She's been there for a couple of years, which means that we've got something a little bit more local, and it's a bit easier for some people to link in with that service as well. Oh, just with the SOZO machine, I just wanted to give a quick little shout out. Over the last 12 months, I have been doing lots of talks to try and raise some money for the SOZO machine. And because of communities like Murray Bridge, we've been able to, I think there were 9 community groups and individuals that came together to fundraise for me, and we now have a SOZO machine here in Murray Bridge, which is really exciting. So it's actually really exciting because I love it. Our nurses can be a source of emotional support, and this is probably our biggest area of support for all of our patients and their support people. We listen and answer any questions you and your families might have, and questions that you might not have been able to ask your treating teams. And it's not because your treating teams don't want to answer your questions, it's often that you get thrown so much information and it's really overwhelming. So sometimes it's not until you get back in the car and you sit there and think, oh my goodness, I don't know what they were talking about. And you can come back and talk to us and have all your questions ready, and obviously we talk to your treating team if there's any issues with that. We discuss your treatments, your side effects, and things that probably wouldn't do in one session, but we tend to talk about all those other things that impact it as well. How things are affecting your work, your sex life, headspace, family dynamics, your support and dynamics around family, because that changes through the treatment as well, and finances, which is a really huge burden for people. And the other thing is with the emotional side of things, when you finish your treatment, often people are doing really well, and then, like Wendy said earlier, the wheels kind of fall off because you all of a sudden don't have all those safety nets around you. So sometimes I find that's when you need to link back in just a little bit more often afterwards as well. Referrals are a huge part of this, so while I can increase my appointments with you, sometimes you need just that little bit more love and support and a little bit more structure with some of that stuff. So it's about linking you back into your GPs, getting mental health care plans, having referrals to psychologists, which is a really important thing. Linking you and your families, if you've got younger children, linking you in with places like Canteen and Camp Quality, which have amazing forums and really great information for the young ones and the keyboard warriors, so they like to jump online, and that's all monitored by counsellors as well, which I think is a really important thing to do. And again, just with our metastatic breast care nurse, linking in people that are needing more support, linking them in with Deb as well. So I think that's really important too. I've got a case study, and this is a lady that I looked after a little while ago. She was 35 years old with a husband, had 2 children, diagnosed with breast cancer and had surgery, radiotherapy and chemotherapy. Later on down her treatment path, a close family relative was diagnosed with end-stage metastatic cancer, which kind of changed a lot of things for her. So I'll just go through how we kind of put all of this together. So when she was first diagnosed, there was lots of new information, which was really complicated and really overwhelming for her. And when I first met Sarah, it was going through her treatment plans, what she understood about her disease and what she understood about the treatments and things. We talked about finances and how she thought that was going to impact her. She was 35, so she was working. It meant that she had to take lots of time off work, which meant there was no income coming in for her. We discussed lots of treatment and side effects and management options, like trying the cold cap or not trying the cold cap. She chose not to do that, but it was one of those things about being aware of what's around and out there. We talked lots about bowels, which I do a lot of, I'm sorry. Appetite, mouth care, neuropathy, sleeping issues. Talked about how things were affecting her and her family as the treatment was going on. And because she had chemo, she went into like a chemical menopause type of thing, so hot flushes, talked about body image and intimate concerns that she was having because of some of the treatments and side effects from those treatments as well. Originally, Sarah decided that she wasn't going to have radiotherapy, and when we talked about that, it wasn't because she didn't want to have radiotherapy, it was because of the impact and the burden that she thought she was putting on her family. So it was about linking her into other services as well. So kind of covering that little bit, but making sure that we talked to her about transport options, and because there was another family member, she didn't feel as though she could ask other family people to take her down for treatment, so we were able to link her into local services for transport and things. Finance was a huge issue for her, so it was about linking her in with social workers, and they were able to do some other financial applications for her. Cancer Council did the financial aid, that one-off payment that you can get as well. Physio and exercise programs, they wanted her to do a program in Adelaide, and so we just linked her into a local one, which, while it's really good for recovery, it's good for headspace, and she found that that was the thing that helped her through her treatment, was getting out and having exercises, and she actually met some other people in those programs, which were local people, which was really good for her as well. Emotionally, I didn't really see her very much in the beginning, to be honest. She didn't need me. She had lots of support, she had lots of treatment plans, she had lots of appointments, and really didn't need me very much at the beginning. So we can answer questions that you're concerned about, and our service changes as you need it to change. So she didn't need me at the beginning, but when her treatment plan changed and when she had her family member that was diagnosed, she needed a lot more love and support. So it was about linking her back in with her GP to have a mental health care plan, and then going off to see a psychologist, which she found really useful as well. One of the other things, I think we've talked about the psychologist's exercise, the Otis Foundation and Cancer Council also offer accommodation for people that have been diagnosed. So she was able to go away with her family, and they were able to spend time as a family, not about the cancer, but it was about them spending quality time together again, which was really nice for them. And the other big thing was making sure that her children had support, so linking them in with Camp Quality and Canteen was really important. They were able to do family trips with that as well, and that was a really good support for the family, and also linking her in with her, like with the kids' school. They've often got counsellors and psychologists based in schools now, so the kids were able to have just that little bit more support from there as well. Just clinically, when clinical care kind of continues through your treatment as well, so she had a mastectomy with a reconstruction and an axillary clearances where most of the lymph nodes were taken out. So at the beginning, again, she didn't need my help with the wound care. Things were tracking along really well, but then later on down the track, she had some wound breakdown, so we were able to treat that locally. With lymphedema, she was at a higher risk of lymphedema, so it was talking to her about early signs and symptoms, and luckily she's not had any issues with lymphedema, but we had a sozo that I lent to myself from Mount Barker, and she was able to have a pre-surgery scan of that so we could have a baseline so that if she had any trouble, we could do another measure for her. Skincare we looked after, and we talked lots about skincare, and when she was having her radiation, she didn't need me during that time because she's seeing someone every single day. But that 7 to 10 days after you finish your radiation, unfortunately, the radiation continues to provide you with a little bit more love. And her skin did break down, and so we did lots of management around skin issues then as well. When she'd finished her radiation and a little bit further down the track, she developed some radiation edema and pain and swelling in her breast, and so she did come back, and we did lots of care about, we did lots of laser massage, taught her how to do self-massage so she could manage that herself. Pleased to say she doesn't see me anymore, which is probably our goal really, is that you get to a point where you don't need our service anymore, so you've got enough love and support around you that you don't need us. Linking into a breast care nurse, if you haven't got a breast care nurse and you feel like you need to have a McGrath breast care nurse as well, most of our referrals come from Breast Screen SA, and so when you're diagnosed through routine mammograms, and otherwise they can come through your public and your private hospitals through your breast care nurses and also your GPs. But you can also do self-referrals. So if you've got family and friends in other areas that haven't got a breast care nurse, you can actually go to the McGrath website and find a nurse, and you can put in your postcode, and it'll actually come up with your local breast care nurse, or you can just link in with one of us and we can help you with that as well. So hopefully your roller coaster ride is just that little bit smoother if you have a McGrath breast care nurse with you. That's it. Thank you.